Hello, I am Dr. Stickney, and welcome to Ask the Vet Live, presented by Good Charlie Energy. In the next 30 minutes, we are going to talk about things happening at Spay Neuter Network, information that is of pertinence to your pets, and take your questions live here as we are chatting, as well as go through some questions that have been emailed to me prior to going on the air. I'm so glad y'all are here with us today. Happy August. Summer is wrapping up, school's getting ready to start back, and there's all kinds of things going on. Regarding things happening with Spay Neuter Network, we have some events coming up. And all of these dates, all of this information I'm going to share with you, as always, is on our website at spayneuternet.org. So you don't have to be scrambling to write it down. But we have some upcoming free vaccine clinics. All of these vaccine clinics will give free parvo distemper vaccines for dogs, free FVRCP combo vaccines for cats, and some of them will also have free rabies vaccines. Other things will be available at a low cost, and two of these are coming up this Saturday. One of them is here in San Antonio, where I am located at, and it will start at 8 a.m. at Lincoln Park in San Antonio, Texas. The other one this Saturday is going to be in Dallas at Dallas Animal Services starting at 9 in the morning. There will be more free vaccine clinics later on this month. Those will be in Fort Worth, Dallas, and Garland. And for those exact dates and times, you can find that information at spayneuternet.org. You know, these vaccine clinics are coming at a perfect time while you are getting all of your back to school, getting ready to get here into the fall. It's a great time to get your pet up to date on their vaccines. This past month, July, was National Immunization Awareness Month. So it is important that we have our pets be vaccinated. Vaccinations are one of the most important things that you can do to protect your pet from common diseases, bacterial and viral diseases that they can acquire. I was just reading that in my hometown of Wichita Falls, Texas, they have had a major outbreak of feline panleukopenia virus. And this is a virus that can completely wipe out the immune system of a kitten and cause them to die. There is no specific treatment for it. It's just supportive care and trying to get them to pull through. And this is a disease that we are able to vaccinate for, and the vaccine is incredibly effective and safe, and that is a virus that is easily spread from one cat to another. So that's just one example in real life of a disease that vaccines would be able to help prevent your pet from getting that. And the majority of pets that have feline panleukopenia will die from that. So as always, an ounce of prevention is worth a pound of cure. And in this case, there would be no cure. So preventing is key. All right. While we are waiting for some questions to come in, let's go through some questions that have been brought to me, emailed to me prior to going on today. One of them is from Cleo. Cleo asks, is there a big difference between deworming treatments from the vet and the ones that you can buy at the store? So the answer is yes, there is a difference. So both of them are effective. The dewormers that you can get from your veterinarian tend to be the more modern, more up-to-date, newer deworming therapies that are available. The ones that you can purchase at the store may be a newer one, but they may not be as well. There is generally, from your veterinarian, quality control from the companies that supply those dewormers to the veterinarian's office is often more carefully looked at than the ones that you can buy over the counter. The ones that are over the counter may be out of date or have been sitting on the shelf for a long time, so they may have lost some of their effectiveness. And when you are deworming your pet, there are a number of GI parasites that your pet can suffer from, and they will some of them will have different medications that are used to treat them. So you may buy something from over the counter thinking that it will be good for whatever types of worms you're seeing in your pet with your pet, and it's actually not the right medication to treat that particular type of worm. Whereas at your veterinarian, we can not only do a fecal exam and see what exact parasite your pet is suffering from, but a lot of times the dewormers that we have will be effective against multiple species and different types of worms. So generally speaking, over-the-counter dewormers are great if you have a mild infection, a first-time infection, or are doing it just as a preventative measure. But if that's not doing the trick, or you're not exactly sure what's going on, or your pet is having some more severe issues, you will want to get those treatments from your veterinarian. Great question. All right, Jesse asks, hello, I work at a dog boarding daycare facility, and one of our boarders threw up his meds 10 to 15 minutes after eating them. He gets levetiracetam and zonisamide every 12 hours, and those are generally used for seizures, for anyone that doesn't know, which probably a lot of people actually. But am I able to give him another dose, or should I wait to re-administer it tonight? So the general recommendation is that if an animal vomits within 30 minutes of taking its medication, not very little of that medication has been absorbed, and as a result, if it's within 30 minutes, you can redose that pet with the medication. If it has been longer than 30 minutes, you should wait until the next dose. But if it's within 10 to 15 minutes, it should be fine to redose that pet. Great question. That happens commonly. Another time that comes up as a question is with heartworm preventatives. And an owner will have given their pet its heartworm prevention, its oral monthly heartworm prevention, and the pet will vomit, will throw that up, and it's like, well, now what do I do? Do I give another dose, or am I good? So if it's been within 30 minutes that they have vomited, give another dose. All right. Becky says, hello. We're planning to adopt a kitten born on June 1st, but today we visited our relatives and learned that they've lost a cat to feline panleukopenia virus recently. Now I'm wondering if it's safe to bring the kitten into our house in case we have virus on our shoes, clothing, and bags. If not, how many shots can guarantee her safety, and how do we disinfect our shoes and things? All right, that is an excellent question. And I guess the first harsh reality that I would say is that in life there are no guarantees. So what we can do is do everything we can to mitigate risk and increase the odds of preventing something from happening. So that being said, the panleukopenia virus is a really strong virus, and it tends to survive outside of the animal's body for a very long time and very well. So you are absolutely in your. It's correct to think, could I have brought this in with me? What do I need to do? So your clothing, run it through the washing machine. Hot water, that will take care of that. It'll wash all of that off. Your shoes, put them in a bleach solution. Or throw them in the washing machine as well, and that will disinfect your shoes. And then your bags as well. You can wash those if they're washable. And that will be everything that you can do to eliminate that as a risk. Now, with the shots, we will typically recommend getting your kitten's first shot at 5 to 6 weeks of age. And then we want to do at least 3 of those shots every 2 to 3 weeks until we get out to about between 12 and 16 weeks of age, 3 to 4 months of age. And that is the point at which the maternal immunity, the antibodies that the kitten got from their mother, will have worn off, so the vaccines will actually be effective. So I would say that then the best way to ensure that your pet has a strong immunity against that virus would be to make sure that they have had a full vaccine series before you introduce them to any other cats or take them to visit or anything like that. An excellent question. Okay. Oliver says, "Hi, we have a general question about microchips. If a cat is brought in for a scan and it turns out they have a microchip registered to someone else, is the vet required to contact the registered owner or share that information with them? We want to make sure we're doing the right thing while keeping the cat's best interests in mind." So the answer to this question is that there is no good answer. There is not a legal requirement for anyone to do anything with a microchip. So typically, if you bring in a cat and let's say you found this cat and the veterinarian, the shelter, whatever, scans the cat and says, well, this cat has a microchip. At that point, it may be a question of, do you want to keep this cat or do you want the cat to find its owner? Then, if that's the case, the microchip information is entered into a database, and it will, if the owner has registered that microchip with the microchip company, then their information will come up. If the cat was microchipped, but that microchip registration, but the owners that had that cat when it was microchipped did not register their name with the company, there's no way to attach that microchip to that owner. So it's a microchip with really no information attached to it. Which brings up a very important point with microchips is that once that pet has been microchipped, you need to contact the company and make sure that they register your name to that particular chip. Now, if the chip comes up with the owner's information, some of the microchip companies will have a privacy hold on their information. And if that privacy hold is there, it means that the veterinarian cannot give you their information. If the owner has elected to remove that privacy hold, then the veterinarian can either contact that owner or give you the information to contact that owner. So there's a lot of variables here. And the bottom line is that there is no particular obligation. The general thought with the microchip is that I got my pet microchip because I want it to find its way home, and that would be something that would be reasonable to expect. But there is no legal requirement for the veterinarian that says he must contact that registered owner. So there's just a very muddy answer for you. If you were to say, we found this cat, is it microchipped? We'd like to, if it is, we'll get it back to its owner. That's one thing. If you said, I found this cat and we really, really want to keep this cat, the veterinarian may or may not elect to contact the microchip company. So it's a big gray space, and there's not a very good answer for that. The most important thing that I could say is that when you have your pet microchip, make sure that you register your information with the microchip company so that the pet can be found and returned to its owner, the cat or the dog. All right, that's a good question without a very good answer. Mabel writes, I have a very sweet 4-year-old cattle dog border collie mix who becomes extremely anxious at the vet despite multiple attempts with fear-free meds like gabapentin and trazodone. Unfortunately, each visit seems to make things worse, and he now reacts even to the meds themselves. We've been unable to complete routine care like vaccines because of this. What options do we have for safely addressing his medical needs, especially in an emergency? Are there alternatives like home visits or injectable sedatives that we can explore? So this is a great question, and it does not have a very easy answer. So it sounds like this dog is very reactive to certain situations and around certain people or new environments. So especially if the medications aren't making a big difference, because that's one of our first go-tos for those sedatives for the pet to relax when we see them. So there are a few options. One would be that your veterinarian could refer you to a veterinary behaviorist, and they're only job is to investigate animal behavior issues and find solutions for those. And those can sometimes involve long-term medications, and along with behavioral therapy and conditioning to help make a fearful situation less fearful. So that's one option, is to consult with a veterinary behaviorist. Another is that there are some mobile vet practices and mobile veterinarians that will come to your home and do all of the routine things there at your house while you're there with your pet. And you can do an online search in your area for home visits, for veterinary home visits, and see what comes up. That may be something that is an option for you. Zoe, a great question. Zoe writes in and says that I've read that environmental allergies are more common than food allergies in dogs. My 9-year-old Pitty has been licking and scratching her paws for about 3 weeks. She loves playing in the grass, has normal stools, no GI symptoms, and is currently on a chicken-based weight management kibble. At what point should I consider trying a chicken-free diet? How can we distinguish between food versus environmental allergies? All right, so this is a good question, and it is tricky question day, because there is not a easy, clear-cut answer to this question. So there are blood tests that your veterinarian can perform that will be an allergy panel, and it will say all of the things that your pet is allergic to. And that may include things like common grasses in your area or common tree pollen in your area. And if that's the case, then that gives you a pretty good idea that you're dealing with environmental allergies. Food allergies can be a really tricky condition to diagnose, because what you have to do is place that pet on an elimination diet, which means that if the primary source of protein in the diet is chicken, then you would want to switch them to a novel protein diet, which means a diet that not only has no chicken, but that also would not have other proteins your dog is likely to have encountered, like beef, in some cases lamb. So it can be a challenge to find an actual diet that is completely free of problematic proteins. Once you find one of those diets, then you put them on the diet for 6 to 8 weeks to see how they respond. So it can be a real challenge to differentiate that. So one of the things that you may want to do then would be to consult with your veterinarian about the two, and there are some prescription novel diets that your veterinarian can prescribe that are going to be made out of things like kangaroo, or sometimes duck is another one that you might find that you may encounter, that we could do as an elimination diet. We also may be able to symptomatically treat your pet with some of the different medications that are out now that block the itch response to things that your pet is allergic to. So consulting with your veterinarian would be one thing to do. If you notice that this problem is occurring when there are, say you're in San Antonio and the cedar trees are starting to pollinate, and you wake up in the morning and there's a coating of cedar dust all over your car, and that coincides with when this itchiness started, then that would lend support to the idea that this is an environmental allergy. And once that season stops, hopefully the itching would stop. So there's a lot of possibilities for this question, and not a real clear-cut answer, but involving your veterinarian may make a big difference. If it only happens after your pet goes out and plays in the grass, then it may be an allergy to the grass itself, in which case after they play in the grass, you'd want to take a cool washcloth and clean off their paws and their mouth and their face, and just wipe them down and see if that gives them any relief as well. All right. We have a question here. What do you suggest to help a 1-year-old French bulldog with itchiness? All right. Well, that is a great question, and welcome to owning a French bulldog, because French bulldogs are can have a lot of itchy issues, and one of those biggest ones is going to be because they are allergic to something. So, the things that you can do with your bulldog right now, you are going to want to develop a good relationship with your veterinarian, because French bulldogs can have a number of different kinds of health issues. So you're going to want to have a veterinarian that knows your French bulldog and can talk with you about possibilities like allergies with them, and second with you, and secondary skin infections relative to those allergies. So in the meantime, one of the easiest things that you can do would be to purchase a oatmeal shampoo at the pet store. And oatmeal is a skin soothing ingredient in these shampoos, and it will help to remove the itch. And it's a safe thing that you can do for your French bulldog right off the bat. You'll want to give them a bath with that and let that lather set on them for 10 minutes before you rinse it off, so that it has a chance to absorb into the skin, and see what kind of relief that gives you. And if that helps, fantastic. It may help some, but not all of the way. The other thing you'll want to do is consult with a veterinarian regarding your Frenchie. Great question. Itchy dogs and allergies in dogs is a big issue. There are certain places like here in San Antonio where there are so many allergic dogs, and so many things to be allergic to, whether you're a person or a dog. And if you own a pit bull dog or a bulldog or a Frenchie, you are going to more than likely deal with allergies in your pet. So I'm hate to have to say that, but it is a sad fact. Okay, another question that we have. My cat is on a diuretic and blood thinner after a heart failure episode. I've been giving her medication at the same exact times daily, but I'm wondering, does it make a big difference if the timing fluctuates slightly, like 7:45 instead of 7 o'clock? I want to be consistent, but also realistic. So that is a great question, and and you can absolutely be realistic, because we all live in the real world, and sometimes it's just not going to work that it's going to be 7 o'clock every single day. So you do want to be as consistent as possible. I would say that if you're within 45 minutes or an hour of when you regularly do that, that is great. You are on the winning side. So be happy that you're doing that. It's great that you are doing that and doing everything to take care of your cat after a heart failure episode. That's scary stuff. And you do want to be consistent with it. You are being consistent. Keep up the good work. And it is okay to have a little bit of wiggle room in there. Okay, let's see. Samantha writes in and says, my kitten was spayed 4 days ago using an intradermal closure with surgical glue. The vet said a cone wasn't needed, but I just noticed she's licked off the glue. I'm getting anxious. How do I know if the wound is still okay or if she needs to be seen by an emergency vet? There's no bleeding or swelling right now, but I want to be safe. All right, so this is a great question. We will typically say that your pet needs to not mess around with that incision for 10 days after surgery, at least. And here we are 4 days, and we notice that the sweet kitten knows that something's different about it, so he's there licking at what he's found. And that tissue glue, that surgical glue, it kind of gets hard, and it's something that they can feel on their skin, and they'll start licking at that. So the first thing that I would say is that if you notice that your cat is licking at that area, you do want to get a cone. Whether you get it from your veterinarian or whether you pick up a cone at the pet store for your cat to wear, I would recommend doing that right away, because if the incision looks great now, fantastic, and hopefully it will keep looking good. But the more the pet licks at that, the greater the chance that it's going to get infected. So if we can stop that now, that's all the better. So I would recommend getting a cone to get the cat to stop licking in the first place. Now, do we need to have the pet seen by an emergency vet? Not necessarily. One of the things that we're looking at after surgery is looking at that incision, and the general rule is that it should look better every day not worse. So if it still looks clean and dry, not bleeding, not red around the edges, no discharge coming from it like pus or kind of a bloody fluid coming from there, that's good. And if that's the case, not opening up, okay, so if that's all the case, then you're in good shape. And what you really want to do right now is keep your cat from looking at it anymore. But if it is bleeding, if it is opening up, if it is red, it feels warmer to the touch than the rest of the cat, it bothers the cat doesn't like it if you touch it, or you see any kind of a discharge from that, then that's something you want to get checked out and get started, get that evaluated, probably get started on some antibiotics to get that infection under control before it gets worse. Incisional infections are one of the most common complications after surgery. And the most common reason for that to occur is for the pet to be licking at it, and there's nothing clean about a mouth. So they're licking at it, and the old wives' tale that if you let the dog lick the cut, it'll heal faster. That's so not true. So we want them to not lick at it. If you live at my house, the other pet, even though the pet is wearing its e-collar, all of the other pets will decide they want to help the pet by licking at its incisions. So, we've got that to deal with too. So no licking, and then as much as possible, exercise restriction for the kitten, which I know is, it's like telling the wind not to blow too hard. It's getting a kitten to lay low and take it easy. It's not an easy thing to convince it to do. But we do want to encourage it not to actively jump around and play a whole lot if we were able to do that. And that allows all of those stitches on the inside to stay nice and tight and let everything heal up as fast as possible. So that is a great question. Okay. Oh, wonderful. All right. So while I see if any other questions come in, just let me recap that we do have those free vaccine clinics coming up, and you can find all of our information about that and lots of other things about your pet at spayneuternetwork.org. This Saturday, if you need your pets vaccinated and you're in San Antonio or Dallas, in San Antonio, you can come to Lincoln Park at 8 a.m. and we'll be out there until 11 vaccinating pets. And in Dallas, at Dallas Animal Services at 9 a.m., all of our free vaccine clinics have the free parvo distemper vaccines for the dogs, the free FVRCP vaccines for the cats. We may have some free rabies vaccines as well. It kind of depends, but and we'll have other vaccines available at a low cost. So that is coming up this Saturday, and there'll be some more this month. So keep an eye out on our webpage for when those come up. So remember that having your pet vaccinated is one of the most important and most responsible things that you can do as a pet owner. The diseases that we vaccinate for are some of the most common diseases that pets will get that will cause some of the most common and most dangerous problems for them. Parvo in dogs, especially in puppies, is a devastating disease. It affects the rapidly growing cells in their bodies and their intestinal lining. So it not only causes terrible diarrhea, but it also can cause them to it wipes out their immune system so that they can't fight against any sort of other bacterial infections that might occur, and they just do very badly. So having them vaccinated is really important. Oh, here's another question about the Frenchies, which was the most popular breed of dog last year, and I believe is this year as well. I haven't seen those exact numbers yet, but people love their Frenchies. And let's see, we ask, I know some programs do the free spay and neuter, but they won't do the French bulldog dogs. Why is that? So the reason for that is because bulldogs, whether they're French bulldogs, American bulldogs, they are what we call brachycephalic breeds. And that means that they've got those cute little punched in noses like that. And but the other issue with that is that it really can make it more difficult for them to be able to breathe, and especially if it gets hot. And when we place an animal under anesthesia to do surgery, we basically are they will still breathe on their own, but we're taking away their ability to kind of regulate themselves. So when they recover, they can sometimes go into respiratory distress and have some issues with their breathing, and we don't want that to happen. So that is the reason why at the free spay neuter event you'll often see that they have restrictions about brachycephalic breeds, because they're working on a lot of different animals. They want all of the animals to do well and be safe, and we know that there are extra breathing complications with those breeds of dogs, and we don't want to have a negative outcome and have something bad happen with someone's pet, and that is the reason for that. Thank you, everybody, for joining me today. It has been great talking with everyone. Have a great rest of the month. And remember to we work in collaboration with Good Charlie Energy on our website, and here on this Facebook page you can find links to not only our organization but also to Good Charlie Energy, and you will find, if you check them out, that you have free access to chat with veterinarians anytime, that there is a discount pharmacy, and then we'd also love if you could leave any questions for us for when we do our next Facebook Live. Thank you. Have a wonderful day.